Good morning, everyone. Turn it up. Thanks. Good morning, everyone. I'm going to ask that we please take our seats. We are about to start. Right. This is the one at the end. Good morning again, everyone. Just asking you in the interim until our official start of the opening ceremony, if you could please familiarize yourselves with the contents of your folder to make it easier for us when we get to the working groups. So now we're going to start soon with the opening ceremony, and then we will go into presentations to outline just why we are here and what this Intra-Action review is all about, the methodology, and a little overview of what has been happening with the COVID-19 response, preparedness and response actually, from the 1st of January 2020 until the 30th of June 2022. We ask for your very frank comments, and you will have facilitators to guide your work. So we do anticipate that it will go extremely well, but based on the audience here, I know that the results at the end of the workshop will be meaningful, and we'll be able to take the preparedness and response for health emergencies forward. So has everybody seen the agenda? No, you can look at it in the meantime. And it's a full 2.5 days, but we will ensure that you do have some downtime even between the sessions and over lunch. So please continue to peruse the agenda. We'll tell you all about the groups that you have been assigned to based on your training, knowledge, experience, and exposure. So please feel free, and any questions that you have from this stage, we will hold them till after the opening ceremony. Everybody fine with that? I didn't hear. Thank you so much.
Well,
Yes,
again.
thanks. Yes, good to have you, Minister. Yours is beside Dr. Dawkins, right? And you're here, Peter. No, that, yes. Minister, the next one. Left? Next one, Minister. Step there. Good morning, everyone. Good morning. One more time. Good morning. Thank you. That's the energy we need for this very important meeting. I'm Marion Bullock-Ducasse from the Health Emergencies Department of the Pan American Health Organization with responsibility for the Caribbean sub-region, and I would like to start this opening ceremony by acknowledging the presence of Dr. the Honorable Christopher Tufton, our Minister of Health, Mr. Ian Stein to my immediate left, the PAHO WHO representative for Jamaica, Bermuda, and the Cayman Islands, and Dr. Nicole Dawkins-Wright, Director of the Emergency Disaster Management and Special Services Branch of the Ministry of Health and Wellness. I would like to ask you all to please stand for the playing of the national anthem. Thank you. Please be seated. We'll now move on with our prayer, which will be done for us to put us in the right frame of mind, not just for today, but for the rest of the meeting. And we have doing the prayer Mrs. Patricia Ingram Martin, Chief Nursing Officer of Jamaica.
Good morning, everyone. Could you kindly stand with me for prayer? Oh God, our Heavenly Father, I thank you for today. I thank you, Lord, for life and for health. Thank you for this opportunity, Lord, that we can meet as a team to discuss the business of health of your people. As we convene this COVID-19 Intra-Action review, Lord, I pray that you will be in the midst. Help us to have frank and fruitful discussions that will inform plans, Lord, and programs to strengthen our health emergency system. Bless the organizers of this event and bless the leaders of the PAHO and the Ministry of Health and Wellness. Bless the workers, Lord, of these two entities. And I pray, Lord Jesus, that you will just be in our midst today. These mercies I do ask in your name. Amen.
Thank you very much, Mrs. Ingram Martin. To point out to those who have not seen it, we do have a special program in your folders for the opening ceremony. So we'll be following through with this program. I want to start by again welcoming everyone in the room here and also those who would have joined us on the Zoom platform. We wanted to ensure that the participation could be as wide as necessary and as deep as possible. So we are here from the 7th to the 9th to take a very strategic look at Jamaica's COVID-19 Intra-Action review and the results that will be provided from the meeting, which will help to guide the framework to enhance the health emergencies program and also pandemic preparedness. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Mr. Ian Stein, PAHO WHO representative in Jamaica, Bermuda, and the Cayman Islands, Dr. Nicole Dawkins-Wright, Director, Emergency Disaster Management and Special Services of the Ministry of Health and Wellness, representatives of the Ministry of Health and Wellness at all levels, representatives of stakeholders and other partners, both in the public sector from various ministries, departments, and agencies, and also the private sector, the PAHO team, representatives of the media, and a similar grouping of persons who are on the Zoom platform and will be sharing in our work. I would like to say at the outset that if we look globally, other countries are undergoing the same type of review to provide guidance in terms of, as we say, saving lives and ensuring that we're reducing suffering and ultimately contributing to the development of all the countries of the world. In his foreword to the launch of the COVID-19 Strategic Preparedness and Response Plan for the period the 1st of February 2021 through to the 31st of January 2022, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, remarked that, and I'll quote, "The COVID-19 pandemic is in many respects unprecedented, but in no respect was it unforeseen. As we focus on our immediate collective response, it is vital that we learn from our mistakes, mishaps, and missed opportunities of the past if we are to avoid repeating them." In that light, the director of the Pan American Health Organization continues to remind member states in the region of the Americas that a total response is required, utilizing all of the tools and the measures that we are aware of, and more importantly, that we know that they work. And all of this to ensure that we contain the COVID-19 pandemic. I also wanted to point out that for this session, we really are going to be looking at some topics that cover the whole gamut of any pandemic response, but focused on COVID-19. And we want to be looking at what went well, what went less well, and why, and then coming up with prioritized actions and timelines in terms of how to improve our systems. We want to thank our main sponsor and partner that enabled us to have this workshop, the European Union, and to say through one of their COVID-19 response projects, the Ministry of Health will continue to benefit from events such as this one. As a reminder, as I close my own remarks and continue to say to the team here, keep up the good work, continue to ensure that you work in a coordinated approach and that we remember that there are best practices within our own systems, within our own people, and outside of Jamaica and the region of the Americas. So as we go on to recognize that we have two public health emergencies of international concern that we're managing now, the COVID-19 pandemic and we have the monkeypox multi-country outbreak, that it really requires a concerted effort on the part of all of us within the health sector and across sectors. So thanks for being here, and we certainly look forward to your full participation, as I know that you always give, and the results, of course, are of the standard that, as for other countries, they are posted for other countries to be able to capture some of what happened here in Jamaica and to learn from our best practices and also challenges. I move on now in the opening ceremony, and I'd like to invite Mr. Ian Stein, PAHO WHO representative in Jamaica, forward and provide his remarks. Thank you, PWR.
Good morning, everyone. So allow me, of course, to recognize Dr. Right Honorable Christopher Tufton, the Minister of Health and Wellness, as well as Dr. Nicole Dawkins, the Director of Emergency, Disaster Management, and Special Services, and inclusive of the welcoming all of you, as I like to say, as a beekeeper, the worker bees, they get all the work done. I often use metaphors in some of the work, the discussions that I use, because I have a few hobbies. I'm a beekeeper and an avid bread baker, so I often use the recipes for success in some of my conversations and the metaphors with bees. I think that Dr. Bullock-DeCass has laid the foundation for the conversation today, and I'd like to actually take the opportunity to try and build on that foundation and build it in such a way, both the formal way, but also some of the informal way, to just lay the tone down for the important kind of conversations that we need to have over the coming days. So, of course, the most important thing is I'm so pleased to see us here together. I know that it has been difficult to get the agendas right and for us to finally meet in this opportunity. However, we must reflect on the fact that this space is a really important space for us to take that time to reflect and to learn on what has taken place in this very, very, very difficult time over these past years. The time together is intended to be a structured process. This is not an informal piece where this team together puts together the approach. Instead, no, it is intended to fit within an international context. And so in having this meeting today, Jamaica is joining over 120 other countries that have gone through a similar process to try to share from the lessons learned and to try to really take, as Dr. Bullock-DeCass mentioned, the necessary steps to actually overcome some of the things that we've experienced. People would know, if they've heard me speak on other occasions, about lessons learned. And the reason why I smile and laugh about this is that I often distinguish between lessons learned and lessons observed. Because it seems that all of us, and myself included, we struggle to actually learn the lesson. And instead we observe it, and we sometimes are difficult to realize the fact that we haven't learned it. We face the same problems a second time around or a third time around. And so this time, as we come together and building on the wisdom of many countries that have gone in front of us and will come after us, let us see how to take those important steps to address the challenges that we know are there, learn from our successes as well. I'd like to actually take one moment to actually personalize this from my own lesson learned, a very light anecdote. It wasn't light at the time. Many years ago, my wife and I had the opportunity to vacation in a country in West Africa. We had been living in West Africa. And we found ourselves in a different country, and we decided to go for a walk together. And we were kind of liberated by the fact that we were on vacation. We were out of the country that we had grown to live in and become accustomed to. And we weren't sensitive to the fact that it was a new country to us. We were just overwhelmed with the fact that we were having an opportunity to vacation together. And we were walking down in the downtown area, and I suggested to my wife, let's go for a walk on the beach. And my wife says, not so sure. But I said, oh, come on, let's go for a walk on the beach. And so we start to walk down, and my wife very quickly said, we shouldn't be where we are. And in typical, perhaps, husband or male perspective, I said, oh, come on. We'll be fine. I don't know what you're feeling, but let's get over this. Let's just move down. And not 30 seconds went by before we were actually attacked and mugged, lost our passports, etc. And so when we talk about learning the lessons, I assure you, based on that experience and the fist fight that ensued, I have learned my lesson very well, and I listened to my wife's intuition, and I wish I had done that before that day as well. So as we talk about these pieces that we are experiencing over these past times, I know it's difficult to talk about the things that don't work well, but let's be brave. Let's be honest. Let us open up to each other. Some of this we've discussed about in other times, but let us take that step further to say, what can we do to address these in reality? To take the next step forward for us to overcome these challenges, because we know we'll be in this situation one more time and ensuing times as well. I say let's be brave and let's be honest, and I say this because I think it's important for us to honor both the work that we have done, the people outside this room, the families and individuals that have truly suffered over these past years through this pandemic. And our work today and our future work together is intended to build on that and honor their work. And so thank you very much. I wish us all a good success over this time. Thank you.
Thank you very much, PWR. We say that for short, for PAHO WHO representative. And we certainly, those of us who understand about intuition, that little voice, we're not sure where it's coming from, but we know, and when we follow it, we usually have good outcomes. So we're glad it was a good outcome, and you're here with us. We now move on to a musical performance, and we have with us Miss Letitia Thomas, and she is from this part of the country, am I correct? Yes? So I turn over to you, and I hope the mics are as they should be. So please go right ahead. We look forward to your performance.
Good morning, everyone. I'll be doing this one from Miss Marcia Griffiths, or Reggae Queen. Oh, yeah, 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 yeah. Come, let us go to the land of love, where the love light shines so bright above. We will be so happy and free. All your pain will let you be, yeah. You're gonna find that love is real by the feeling you feel in that land where the people are free. Life will be better for you and me. We will find true happiness Come on, yeah. A beautiful land, oh, yeah. Come on, say, yeah. You will find true happiness up here. Come with me and have no fear. And you're gonna find the love is real. By the feeling you feel. Say, oh yeah, yeah. To the land of love, where the love light shines so bright above. We will be so happy and free. Come with me and have no fear, and you're gonna find the love is real. By the feeling you feel, see, love is real. By the feeling you feel, yeah, yeah. Love is real. By the feeling you feel, love is real. Thank you very much.
A bigger round of applause. Lovely voice, lovely rendition. Thank you very much. Dr. Nicole Dawkins, right? Please come forward and introduce a minister that needs no introduction, not just in Jamaica, throughout the Caribbean, the region of the Americas, and globally. Dr. the Honorable Christopher Tufton is well known and always in demand.
Thank you, Madam Chair, Dr. Bullock, the class friend and colleague, Mr. Ian Stein, PAHO WHO representative, ladies and gentlemen here in the room and in virtual land, a very pleasant good morning to you. It is a great pleasure for me to present our keynote speaker today, who's going to set the climate for a fulsome review of Jamaica's COVID-19 response using a hybrid platform. This is something we should all be deeply interested in to better cope with the current events, including the ongoing COVID-19 outbreak, and better respond to the next acute public health event. Our speaker's role in the COVID-19 response is no secret, and his passion to optimize our response has been quite evident. So I say no more on that, but instead highlight just a couple other areas, even though he told me to give him no big introduction. He's the Member of Parliament for the West Central St. Catherine, as you know, the constituency that he normally designates Wednesdays for. But he was gracious enough to dedicate and share this morning with us here today, so we thank him very much for that. He's our Minister of Health and Wellness since 2016, but he has also been the Minister of Industry, Investment and Commerce, and as well as the Agriculture and Fisheries, and also served as Co-Executive Director of the Caribbean Policy Research Institute. A well-learned individual who graduated from the University of the West Indies, Georgia State University, and University of Manchester with degrees in Management Studies, Marketing, and Business Administration, all to bring a very different and clear approach, comprehensive response, and guidance to our review today. He's an author, lecturer, and business strategist. Ladies and gentlemen, please join me in welcoming a very, very goal-directed Dr. the Honorable Christopher Tufton.
You almost followed my instructions. Almost. I've been very curious. I want to ask Ian this question based on his unfortunate story with a happy ending. Did your wife win the fight?
She made the smart
Okay. No, you're not getting me. I figure you ran when you saw the muggers and your wife stood up and did engage them, right? Anyway, I'm happy for the happy ending. And yes, I see the message in the story. Distinguished ladies and gentlemen, I'm not going to hold you too long. I know that this part of the ceremony, or the few days, is supposed to last. Well, the time has expired on it. Let me recognize Dr. Bullock de Cass, who I don't think needs any introduction either, both here in the region and globally, right? Because of the work that she has done and is doing. And of course, Mr. Ian Stein. And to the rest of the family of public health workers in the room, I see regional leaders, Ministry of Health head office leaders, and some, I think, specially invited guests. Really good to see you. Is this the number that you expect, or are you expecting additional numbers? More, and you have online. So to those online, I want to just welcome you. It's an exercise that I think is absolutely crucial, which is why I've decided to come to participate in this short session, the starting session, and to sort of give a perspective on why I think it's important. It is, you know, I think we're fortunate as a country to be able to engage in this Intra-Action review, COVID-19. I would suspect that we are being very proactive in putting this on the agenda, even while we're witnessing the tail end of the COVID pandemic. It's not over, it's still here, but we have enough information over the last 2+ years, I believe, not just to learn lessons, but to continue to adjust in the interest of building greater resilience in public health. And I think it is crucial that we engage in this fashion, where we bring persons who have been on the front line, have been in the planning rooms, have been coordinating and collaborating, indeed have had to retweak and reset the strategy, because there's no playbook for this. We were going and learning as we went along. And I think your perspective is going to allow us a really unique view of what has transpired over the last 2+ years. And your ideas will, I believe, once they contend and you settle down on some agreed positions, will make the plans for the next decade or beyond, and certainly the next pandemic, hopefully not too soon from now, be a much less of a threat because of these lessons. And that's what really we're trying to do here. So, you know, there are some critical lessons that I think we have to deliberate on and seek to strengthen. The issues around partnerships to foster greater resilience is a key one. In public health, and I'm being parochial now, describing Jamaica's public health infrastructure, we have a particular organizational structure, regional authorities, head office, and some critical other bodies like Public Health Lab and NHF and so on. We only function well when that collaboration takes place. And I having been here for 6+ years as minister, I do believe that sometimes that collaboration could be tighter in terms of how information is collected, tabulated, and transmitted. And that's the sort of internal view. Not to say it doesn't happen, but I believe that COVID taught us how important and more important it should be. Now, there are some obstacles to that. Some of that are organizational obstacles, procurement-related obstacles, and those, I think, require discussion, because those hopefully will lead to review and reform. And I think the ground is fertile for that reform to take place. Some of it is based on tradition, right? I need a napkin or something if you have anybody in the room here. Anybody? I left my handkerchief, sorry. But if it's important to review some of those organizational issues that have helped us in the past to rigidly maintain high standards of public health, but with the advent of COVID, almost required a dismantling of some of those organizational structures and traditions and customs, right? You want an example? The role of the advanced nursing practitioners or doctors to administer vaccines, private and public, thank you, or, I don't have COVID by the way, or monkeypox, or the role of pharmacists to administer vaccines. I found that when I was in the early stages of COVID, I give this story to a lot of people, jokingly. We were so rigid in maintaining a particular protocol to administer the COVID-19 vaccine. You know, you had to have a secure space, you know, sanitized environment. The nurse was the primary purveyor of the vaccine. The doctors them just stand up looking because the nurse wouldn't give the doctor a chance, right? When we advanced in the process, a year plus after, I was present, so this is not hearsay, in Falmouth with a nurse and a small ice box with a lady under a mango tree who was frying chicken and selling on the street, and we put her on a chair to sit down, and the nurse took out the vaccine and vaccinated her. Year and a half before that, it would be heresy, punishable by death, because the system was so rigid. In other words, we did adjust, but I'm convinced that the adjustment took a little bit too long because we defended the turf and the protocol, and there wasn't a view that we were dealing with an extraordinary circumstance, and that extraordinary circumstance required adjustment. The pharmacists quarreling over whether or not they should. Now, I know they have to be trained. There are actually about a few of them that are trained, they actually engage. I think we need to move forward, allowing them to administer some of these, obviously not just COVID, I'm talking about the future. We're doing a review now on advanced nursing practitioners. The doctors, very against them, limited prescriptive rights, although they are the ones sometimes up in the deep rural parts. I'm deviating a little bit because that might not be as related to COVID. The point I'm making is, out of a crisis comes an opportunity to adjust in a fairly substantial way. And I hope that the dialogue doesn't end up with a reinforcement of the status quo, but a willingness to dismantle it if necessary. If necessary. That's how we're going to advance. And the lessons should be taught, we should benefit. Now, on the partnership front, I've always believed in partnership. And we benefited a lot from PAHO, you know, donation of equipment, training, and I could go on and on, vaccines and so on. But there are several other partners where there was a struggle to embrace, endorse, and to galvanize their support. Public doctors versus private doctors, private sector versus, and I could go on. And I think that theme of partnership should resonate more, and we should really push more to see the future of public health being everybody's business. And we shouldn't be fearful of embracing that. The issue around organizational standards, I spoke to that. The evidence-based risk management, I think, is a big lesson from COVID. One of the ways that allowed us, me certainly, and to stay focused on the response to COVID was because, in my mind, I decided that while I was prepared to listen to everybody, you know Jamaica, right? Everybody have a view, and everybody is an expert, especially when they go on social media. You had to ground your decision making on the best available scientific data. And so there are many calls for my resignation, and maybe the CMOs and whoever, because people said that we were not listening. It's not that we weren't listening, but if you listen to everybody, you know the story of carrying the donkey to market? You'd end up carrying the donkey on your back rather than riding the donkey. And so at some point we had to decide that listening up to a point was important because you had to be inclusive, but you had to make a decision. And that decision had to be informed by certain fundamental principles. And the thing was unfolding so rapidly with limited knowledge. Now that took a lot of behind the scenes consultation, a lot of deliberation with the experts, many times having different views. The doctors had different views, for example, to mask or not to mask, et cetera, et cetera. And one of the lessons that came out of that for me was how do you cultivate an organization and points of excellence where you can draw on data and quickly turn that data into decision-making influence and coordinate and collaborate that data to sort of validate, if you will, a best decision process. Because you won't please everybody, and you certainly can't wait to try and get everybody on the same footing. The digitization and how we improve the pace of decision making is a big one. Luckily for us, we are moving in that process, and that process should have had started before COVID. So we are now creating what I would think is the most sophisticated digitized platform for public health through the connectivity of health centers and hospitals, through the software around patient data and telemedicine and so on. That to me is the future. It is the future. And one of the biggest obstacles, I think, to that process is not the technology, because it exists. It's going to be the people and the change management that is required. And I've learned that from just looking at the University of the Hospital experience. I don't know if any UA people are here. But unfortunately, many of them are still struggling with the absorption of a sophisticated health management digital system, because, and I'm sorry to say, but some doctors prefer to take the x-ray and put it under the light to read it, as opposed to read it on their phone. And maybe it has changed over the last year, doc. Is doc that, or is nurse, or is, oh, yes, the mask hides your identity. Maybe I shouldn't say it because now I know I'm in trouble, right? But, what I'm saying is change management is going to be a big part of the future, because we have to move in that direction. And one of the conversations that should happen is how we get to that point, what may be the obstacles to get in there, and how we change. Because we'll become a lot more efficient by extension on an operational level, but in terms of crisis, if we can build around that. And I really want to see a lot of that taking place. I'm interested next week to see the CARFA studies around that. That's a theme of the CARFA study, the CARFA research conference, which will take place next week. But that's another area. The other, to me, extraordinary lesson that I have learned, really it was a learning for me much, because I'm like my training, I'm trained in marketing and communication, is the communication function in times of crisis. One of the, the older you get in this business, the more you don't mind offending people, right? You just talk it as you see it, because you're probably soon gone. You don't need to be to impress anybody. How is that? So when I became Minister of Health, and I assessed why health was always such a difficult ministry, I quickly determined, among other things, that clinicians were afraid of the media. Maybe it was a cultural thing, but by saying no comment, maybe because the tenets of clinical work is that you have to preserve patient confidentiality. And not in doing so, you miss the bigger point of public information and education. So the media really had a negative impression of public health. I mean, you know, a baby fall off a bed, and it's headline because it's sensational. But nobody explains that 35,000 babies are delivered every year. One fall off a bed. That's one too many, don't get me wrong. But there's far more good than some of the negative, right? And one of the things I tried to do was to open up the avenues of communication by encouraging people to talk more in a context while still preserving the confidentiality. And also by assigning the communication, thank you, to persons who are the right ones to communicate. In fact, there was a rule from head office, the minister's office, not me, the minister's office, that hospitals mustn't talk to the media. So when the baby drop off of the bed in Maypen, the minister is on TV talking why the baby drop off of the bed. Now you have a CEO, you know. Maypen have a CEO, they have a SMO, but they don't comment on the fact that they are managing an institution, and for whatever reason, you know, the baby shouldn't, or why it happened. And we kind of decentralized some of that and started to say, listen, you have to take responsibility. On the front of crisis management, I quickly determined with the team that COVID was so much of a frightening prospect. For starters, because of a lack of information around what it was, but also because it represented death to many. That if you don't talk to people and talk to them frequently to guide them, they form their own opinion, and it forces and encourages greater panic and uncertainty. And that's why we had set out with the 2 press conferences, one at the OPM, one at thing, and our regular COVID conversations, which was done every Thursday, and we allowed the media to come in until they were tired of asking questions, till they even stopped, because they now felt that we weren't really hiding anything. I'm one of the most accessible persons to the media. Any and everybody call me. Now, I'm not telling them to answer every and any question that they ask, but they can't say I'm not available, and I direct them where necessary. And so one of the lessons, so I think we did well, and I think, frankly speaking, the strategy around communication helped us a lot in the COVID response. And I think we should take a bow for that. The question is, how do we benefit from that, learn the lessons from that, and put in place a system or a structure that ensures that it is part of our culture? Because up to that point, I don't think it was part of our culture. And there are different ways of communicating. There's the internal stakeholder communication, so your team members, you know, your workers, and of course, there's the community, and by extension, the national. So I do think that that's a big area. I'm winding down. The issue of personal responsibility is also a big one for me in terms of getting people to understand and appreciate more how they can protect themselves in a crisis such as COVID, but also in terms of good public health practices, personal health. I think we're on a really slippery slope as a country, and indeed as a world, in terms of how we have viewed life. Sorry again, but I can give you a little anecdote. I just came back from a little few days break in a country where I tell people I went on a spiritual journey, right? I didn't say a religious journey. I said a spiritual journey, right? And I went to look at the Incas, the Inca Empire, or what is left of it. and just to see how they lived and reigned for 100 years in the 14 and 1500s after Christ. 100 years, they were at the top of their game. And it was quite interesting to see how they utilized technology in their terms and in their era, and research. And the central theme of that was how much they were in harmony with their environment. They respected what was around them. They respected the stars, the Milky Way. They studied it to understand when was crop season and how they were cultivating and all of that sort of stuff. And it dawned on me that we are on a slippery slope as mankind, because all civilizations over time, unfortunately, meets their demise and is replaced by others. We have almost lost respect, if you will, for our own environment, our personal space, and how we treat with ourselves, which ultimately facilitates our demise. I'm talking about consumption issues, air quality issues, water pollution issues. We cut down tree, we don't plant back one. And the circle of life that captures all of that requires that kind of sustainability. And I think COVID has taught us that if we do not get personal, individual responsibility as a start, and then collective responsibility beyond that, there is no public health system that can solve the problems that you have. Because, and for too long, people complain when they are sick that they don't have hospital bed. They complain when they need a surgery that they don't have enough surgeons. That's not saying government don't have a responsibility for that, but they must also appreciate that if they drink the rum and eat the salt food and the sugary drink and so on, then the ultimate issue is going to be this. So when we preached protocols around COVID, and around, wearing the mask and so on, a lot of controversy there, of course. Some people felt that we shouldn't force kids to wear masks, but we're going to have to find a way to centralize, as part of the public health narrative, that personal responsibility is perhaps the most impactful response to health and wellness. If you care more for yourself, right, you are less likely to have premature illness and therefore depend on the public health system. And I think that stood out a lot in the COVID response, and I think we're going to have to do more. So public health is not about hospital bed alone. Public health is about prevention. And that's why we're reforming primary health care to put more people on the ground, more people in the community, more people being encouraged to screen rather than wait until they're sick, that kind of thing. That has to be, I think, a much more dominant message for the future. All right, so I'm hoping, in closing, that we will be frank and we will say it as we see it, and not fear that you're offending the status quo. This kind of work here, or workshop, is not a workshop to articulate traditional views. It is to be bold and to explain why traditional views may no longer be relevant. Or if you want to go all the way back to the Incas, why the Incas' lessons for us are more relevant today than what we are doing. So if you come in here to reinforce traditional views, you're not going to learn the lessons of COVID. You have to, so everybody should jot down one point that turns traditional views on its head. And then you quarrel over it, and then you conclude. And then we assess. And even if we take 5 out of the 20, then we'd have made some progress. Thank you very much. Have a good day.
Thank you so much, Minister. As always, very enlightening, to the point, and making sure that the relevance is there to not just what we're doing, but to the entire health system, ultimately, communities, Jamaica, and other countries. We're now going to be closing this ceremony, and I think all that is left for me to do is to thank again Minister for his excellent keynote address, and I hope that you're making jottings. I made a few notes mentally, and to thank the PWR for his charge as well, and Dr. Dawkins Wright for almost fulfilling what Minister asked her to do. But I think she was very brief, Minister, in terms of all that could have been said about you. So to the team here in the room, to the virtual team, will be connected in the group work. I just want to say thanks for being here, and the fact that you are here, we know that you are ready to give up your best as always, and we look forward to the rest of the time for the workshop. Ms. Thomas, did she leave us? Please convey our thanks to her for her excellent musical performance, and she can drop in at any time and sing for us. We might need her to give us a little boost. So we're going to ask you to put your hands together and stand in the interest of health to get moving, Minister. While they're telling you goodbye, you can clap up here, clap all over, clap hands, and make sure that we give a big thank you to Mr. Stein, Minister, Dr. Dawkins, right? And give yourselves a clap. Okay, so. And Minister, I have to say thanks, a special thanks for being here. We know what Wednesday means to you, so we're glad that you came. You're far away, but we know the drivers are safe with you. Okay, you can sit, stretch. All right, so please. They want me, us? It says it. Minister, they need to do some photos, not sure who, with who, whom. You just want us and where's his? Okay, we are going to move ahead. Dr. Dawkins, right? You are next on the program. And we're... Oh, you can... okay, sure. So we're going to try and make up some time as we move ahead. we're going into introduction of participants, not individual introductions, and then I will do an introduction of the Intra-Action review methodology, and then Dr. Dawkins Wright will look at the response plan and just some actual timelines of what happened with the COVID-19 response. So you see where we are with timing. We are a little bit behind, but we will make it up, and certainly in the group work, I'm sure we can regain some time, and we will shorten our coffee break. Dr. Dawkins, right? We can, okay, she's coming. So we want to, of course, I'm sure you'd like to know all the persons in the room. And so the introductions at this stage is not individual, but Dr. Dawkins, right, will just take us through the main groupings. And as we get further along today to save some time, then we will get to know each other a little better.
So good morning again, everyone. I think we have maybe about 50. We should have, rather, 70 persons in total. We have a few in the room. We have who is here in the room and those who are on the platform. So in the interest of time, we weren't going to go through individually. So I'm advising you now just who is actually here, and that is what is going to actually inform how we put persons together so that we can have the group discussions according to the themes on the agenda. So we would have asked and invited persons based on their location in terms of the response. So we'd had the team leads, certainly from national level in terms of the technical programs, so the branch heads for who were health services planning and integration. We have, I think, Dr. Webster Carr, Dr. Harris, from National Epidemiology Unit, Health Protection and Promotion. I believe I saw earlier Dr. Chambers wasn't here yet, just yet, on platform, I think, as well. And of course, the Emergency Operations Center for the Emergency Disaster Management and Special Services. Then we would have had as well our entities from the national entities, from the National Public Health Laboratory, the National Health Fund, as well as the University Hospital of the West Indies. The regional health authorities, we would have invited as well the regional technical directors and representatives from the local department, the parish health departments, and a few facilities differently to represent the different structures within the system from the regional heads. So we have some medical officers of health who are here. I think we have, for all regions, we have 2 representatives. Medical officers of health, a few in the room and some online. And we would have had our environmental health team, our points of entry personnel in terms of the port health program and all the other activities related to that, our health protection, public health promotion and education element as well, team representatives. Again, we spread out across the different regions. So we have as many persons locally in the room as well as online. Our PR representative in terms of the communication. Then of course we went on in terms of our nursing teams at different levels. So we'd have our senior nursing officers, our regional nursing supervisors. We'd have had our senior nursing directorate. certainly from head office, chief nursing officer, as well as directors of nursing services at the hospitals, and of course our community. I think we have 2 community health aides online as well. We have representatives as well from our institutional health program for the environmental health programs, and of course where there are structures in place for the infection prevention and control program, we have our IPC officers. We have 2 in the room and 4 online. We have representatives in terms of our care team, so the critical care specialists, or laboratory and imaging specialists within the health system in and of itself. Then of course we'd have had several partners who had to participate in the overall response. Of course we start out, we have our head of entity from PICA, Mr. Winter, was nice enough to join us all the way down here. Thank you very much again. And several other players who had participated. I think I saw